So I'm still talking about the HPA axis, hypothalamic pituitary adrenal axis. Stress hormones I'm going to really focus on are cortisol and epinephrine. Most people know of it as adrenaline. When we are under stress, we get cortisol secreted mainly from our adrenal glands, and also epinephrine, adrenaline, will also be secreted from the adrenal glands as well. In this day and age, work, you name it, different pathology, the sickness that people have, just sitting in traffic, the way we eat, the toxins we take in, we are constantly under stress. So a lot of people are constantly secreting cortisol, secreting epinephrine, our fight or flight hormone. And what happens is when we have this chronic stress, it is throwing this HPA axis into dysfunction. And like I mentioned earlier, these imbalanced stress hormones, this leads to symptoms such as fatigue, weight gain, decreased muscle mass, digestive problems, insulin resistance, and thyroid problems. The reason that we see something like decreased muscle mass is because cortisol, you got to remember, cortisol is catabolic. It is something that breaks the body down. It's trying to take from us. We're under stress. So epinephrine and cortisol both, they're catabolic. So they're breaking down the body and what bloodstream. So what happens is the body's going to take it from our muscle mass. It's going to start breaking that down. That's why you see decreased muscle mass, breaking down those amino acids, breaking down muscle tissue, and then also it's going to take those amino acids from our gut lining. And this is such a huge point to grasp, is because when the body starts breaking down the gut lining, that's what's going to lead to that leaky gut. And this is why balancing these stress hormones is so important. And then that's what happens. So we get an imbalance, a dysfunction in that HPA axis, we get an imbalance in those stress hormones, we get mitochondrial dysfunction, the body starts taking amino acids from muscle tissue, starts taking it from the gut lining, and that's going to lead to our leaky gut, and that's going to stimulate our chronic inflammation and lead to our autoimmune disease, and even neurological conditions like depression and anxiety. Cardiovascular disease, diabetes, weight gain have also been linked to leaky gut, along with about everything else. If you're out there with hypothyroidism, have Hashimoto's thyroiditis, it could be because of a leaky gut. So, just like I said, things we see with leaky gut, hypothyroid, depression, autoimmune diseases such as rheumatoid arthritis. We also see weight gain. I kind of just took you through that process because we have insulin resistance. The blood sugar is not getting into the cell. We have mitochondrial dysfunction. So we are not utilizing those fatty acids for energy. Right here, not burning fats for energy. And again, the body needs to make new glucose. So it wants to do that through gluconeogenesis. So it needs amino acids. And again, it will take them from the muscle tissue and from the gut lining. Now, I talked about when we have the leaky gut, this is going to lead to impaired detoxification because we have the leaky gut, we have all those toxins, we have all those bacterial endotoxins, especially in LPS. Now that's being poured onto the liver. It's going to the bloodstream through the portal vein, now all being poured onto the liver. The liver's got to deal with that. The liver is our organ of detoxification. Through phase 1 and through phase 2, very, very complex process, but very important. This is what metabolizes drugs and all the toxins that we're taking in through the air, food, water, and everything else that's out there with plastics. What happens a lot of times is phase 1 gets upregulated, but phase 2 pathway gets downregulated. This is a huge, huge problem because these intermediary metabolites cause reactive oxygen species and they cause a lot of free radicals. And you can see right here, secondary tissue damage. And again, this is going to cause more inflammation and cause all those other symptoms that we're talking about. So with impaired detoxification, now we circle back around and we see the same problems. Again, this is a very, very vicious cycle. We see, again, mitochondrial dysfunction. Remember, can't burn those fats for energy. That's why a lot of times you'll hear people talk about, I exercise all the time, doc, but I'm not losing any weight. That's because they probably have mitochondrial dysfunction and they cannot use those fatty acids for energy. It causes more inflammation, more oxidative stress. We see our fatigue, we see our weight gain, we see our depression, we see leaky gut autoimmunity. Why depression? Because when we have the leaky gut, you get inflammatory cytokines being released into the bloodstream, and they can cross the blood-brain barrier, because a lot of times when we see a leaky gut, we also see a leaky blood-brain barrier. And it's easier for those inflammatory cytokines to cross that blood-brain barrier and to lead to neurodegenerative and neurological conditions, anxiety, depression, schizophrenia, bipolar, Alzheimer's, inflammatory cytokines, mitochondrial dysfunction associated with all of those conditions. So you can see with naturopathic medicine, with functional medicine, we are really talking about the cellular level. Again, I just harp on this over and over again. We are addressing imbalances at the biochemical and physiological level. At the cellular level, we are trying to get the body back to normal function and addressing all of these underlying causes and addressing this physiological damage. And again, that's why we get such great results. So lab testing is fantastic, and that's what we will do with our functional medicine, naturopathic medicine. We'll do a lot of functional lab testing because it guides us a lot of times to the underlying cause, but especially it will show us where that physiological damage is taking place. One of the lab tests that I'll start with will show us those stress hormones. It's a salivary test, very simple. It will show us cortisol, even the diurnal variation. So free cortisol, what is bioavailable, what is active. So what's the cortisol level in the morning, in the afternoon, and at night, midday, and then at night. So we can see the pattern of cortisol, which should be high in the morning, level off during the day, and then get low at night. So a lot of people with anxiety or a problem sleeping, just under a lot of stress, even dealing with weight gain, they will have disrupted cortisol, and a lot of people have hormonal imbalances. That will start with the stress hormones. The thing is, people talk about their hormones, whether that's testosterone, estrogens, progesterone. Our stress hormones can even affect the sex hormones, and that's very, very important. So our stress hormones, cortisol, we'll test for that. That's salivary. And then epinephrine, we know that as adrenaline. That is a simple urine test. And that is measuring epinephrine metabolites. And if those are elevated, I know exactly where to support someone, because we know we need to bring these stress hormones down. Sometimes we need to bring them up. But the testing, the functional lab testing, will show us exactly where someone's imbalance is and exactly where they need support. So we start with the stress hormones, and then I talked about the gut and digestive health, and then also stool testing is very, very helpful for getting to the underlying cause and knowing where that physiological damage is. A lot of these things being off can point us towards signs of leaky gut. So we need to know how much beneficial bacteria there is. Do we need to supplement with probiotics to help heal that gut lining? Is there pathogenic bacteria? A lot of times the underlying cause with things such as Crohn's disease, irritable bowel syndrome, and ulcerative colitis is a bacterial infection, viral infection, parasitic infection, even fungi and yeast. That can be the cause of the inflammation within the GI tract. H. pylori can be a problem if it has virulence factors. If someone is sensitive to gluten, there's a marker for that. That can cause irritation and inflammation of the gut lining and lead to leaky gut. If someone has a deficiency in pancreatic enzymes, we can see that with a pancreatic elastase on this test. And then we can see with calprotectin, if somebody has high levels of inflammation that can break down that gut lining and lead to leaky gut. And I already talked about an imbalance in those stress hormones, an elevation in that cortisol, an elevation in that epinephrine. Remember, an imbalance and an elevation of those stress hormones, that can also lead to leaky gut as well. So all of these things are connected and interrelated and are all very, very important. Another test that we will run is an organic acids test, and this is fantastic because it's a simple urine test and it gives us so much information. At the top there, that says fatty acid metabolism and carbohydrate metabolism. So I was talking about mitochondrial dysfunction, and you might be thinking, well, how do I know if I have mitochondrial dysfunction? How do I know if I'm burning those fatty acids for energy or not? Because of the fatty acid metabolism markers. If those metabolites are elevated, then we know you are not burning those fats